Good day everyone, I am Michael, moderator for this webinar. I welcome everyone for today's webinar, which is demonstrating the role of case management in a value-based healthcare system. I would now like to introduce our presenter for today, Llewellyn. Llewellyn, MS, BHSA, RNBC, CCM, CRRN, CMF, CMGT, BC, is a registered nurse with 40 plus years of experience in critical care, risk management, case management, patient advocacy, and training and development. I would now like to hand over the floor to the speaker. Over to you, Anne.
Thank you, Michael. Really appreciate the opportunity to be here today and to speak on this important topic. The learning objectives are on your screen, and we're going to define case management and its role in today's healthcare system. I'm going to look at some of the healthcare metrics that case managers can use to validate their practice in the healthcare system and discuss the various areas of case management and how they work together to lower cost, assist patients and families, and all healthcare professionals. This is an outline of today's session, and I'm just going to cover each of these topics. So looking at the role and function of case management, you can see that case management are healthcare professionals. These are some of the core functions of case management. So what are some of the settings where case managers work? We're in hospitals, managed care organizations, rehab centers, the acute, long-term acute, the LTACs. So how is case management changing? And I think it's important to know that the healthcare system is changing. And as healthcare changes, case management will change. It's fluid. It's not something that does not change. It has to adapt to where we are today. So what is value-based healthcare? We started out with talking about, demonstrating the role of the case manager in a value-based healthcare system. So why do case managers need to demonstrate their value? Well, all other members of the healthcare team have to show their value, so why not case managers? Elimination due to cost-cutting efforts. So some key performance indicators the case managers can use to demonstrate their value. Improved communication. By just getting involved, talking to the patient, talking to the family, finding out what's going on. So these are some additional metrics that case managers can use. And case managers, when they claim these outcomes or claim the metrics, it's because they were involved. If things are already happening when they get involved, you can't claim those. It's because of your involvement that these things happen. So assisting patient and families in meeting their needs, case managers work themselves out of a job. Educate and be a role model to the patient family to improve care coordination and transition of care. Assist patient and families in managing their care. Prepare for doctor's visits, therapy appointments. Keep notes and records. These are all things case managers can claim. So how do we keep track of everything that we're collecting? Well, today there are systems. We have computer systems, we have electronic health records, we have alerts that can go off. So mediums to demonstrate value. And we are documenting if we need to keep people longer so we're not getting denied payment. That's all important, and it all needs to be done. Your organization website, try to find a mention of case management on any healthcare system website. It would have been a great time to talk about nursing case management within, the celebration of Nurses Week and the value that we bring. So think about that. How can you demonstrate your department's value and the work that you do? Professional development for case managers, so important. Mentoring. New people coming in, how do they learn what case management is? Professional development is ongoing. Many of you are healthcare professionals. You have to do your CEs, but get them in areas that are interesting to you and will help you improve your job, because that's what we do education for. These are some of the resources I want to leave you with. These are some of the professional organizations that you can look at. The American Association of Managed Care Nurses, if you're in managed care, you can Google them and look them up and get involved. So thank you. Appreciate your time listening to the presentation. Okay, well, again, thank you, everybody. This is a critical time in the practice of case management, for our profession. So for people who are on this call, or people who are listening on demand, please work with your teams, help them document, help them report, and let's get the word out about the value of case management, because it is something that can really help the individual patient, their families, the healthcare organization where they work, and help with the whole delivery of care. We need to be able to demonstrate the value we bring and the contributions that we make to the healthcare system. So thank you for listening. Thank you, and enjoy the rest of your day, and appreciate the opportunity.
Thank you, Anne. That does conclude the session for today. Thank you everyone for participating. You may all disconnect now. Have a great day.